All right, guys, continuing with this will be the last part. So this is comprehensive medical terminology, part 3 with the digestive system. So now we're going to talk about diagnostic techniques, treatments, and procedures. So things that can be done, right, to diagnose or treat things that happen with the digestive system. We have an abdominal ultrasound. So this is the use of a very high frequency sound wave to provide visualization of the internal organs of the abdomen. So you can look at things like the liver, the gallbladder, the bile ducts, the pancreas, the kidneys, the bladder, the ureters, and it's a very non-invasive procedure. So it's basically the same thing if somebody's having a baby and you go in to look at the baby, make sure everything's okay. It's the exact same thing. And then we can do abdomen. Okay, one more time. Abdominocentesis. So abdominocentesis. There we go. So this is an insertion of a needle or a trocar into the abdominal cavity to remove excessive fluid. And this is usually done when a person's in a sitting position. And then we have an ALT, which is an alanine aminotransferase. So this is a hepatocellular enzyme released in elevated amounts due to the liver dysfunction. And it's also known as a serum glutamic pyruvic y'all just go with that one. And then we have ALP, which is an alkaline phosphatase. So this is an enzyme found in high concentrations in the liver, the biliary tract, and bone. And then we have amylase, which we talked about just a little bit ago. This is an enzyme that's secreted normally from the pancreatic cells, and it travels to the duodenum by the way of the pancreatic duct, and it helps to aid in digestion. We have an appendectomy. So this is a surgical removal of an inflamed appendix. It may be removed via laparoscope, or if it's ruptured, if a rupture has happened, sometimes they have to kind of open up your abdomen to get everything cleaned out. A barium enema. So this is an infusion of a radiopaque contrast medium, barium sulfate, into the rectum and held in the lower intestinal tract while an x-ray is taken of the lower GI tract. A barium swallow basically does the same thing, but it's taken orally. So it's an oral administration of that radiopaque contrast medium, and it flows into the esophagus as the person swallows. And then we have an capsule endoscopy. So this is a process of viewing the entire length of the small intestine using an ingestible video camera with a light source, and it's enclosed in a little capsule. So it's just like a pill. And this helps in visualizing areas that other diagnostic techniques cannot. There's no disruption to the digestive tract, and it's also known as a wireless endoscopy. Chelioplasty. So this is a surgical procedure or surgically correcting a defect of the lip. And then we have a cholecystectomy. This is a surgical removal of the gallbladder. And then we have a cholecytography. So this is a visualization of the gallbladder through X-ray following the oral ingestion of pills containing a radiopaque iodine dye. A colonoscopy. So this is the visualization of the lining of the large intestine using a fiber optic colonoscope. And then we have a colostomy. This is the surgical creation of a new opening, bringing the incised colon out to the abdominal surface. The abdominal wall, it creates like an anus through your abdominal wall. And that's how feces will be expelled into a bag. True or false? Appendectomy and cholecystectomy remove body parts that are not vital to life. So one removes the appendix and one removes the gallbladder, right? So are these vital to life? So that's true. So the appendix aids in fighting infection and the gallbladder aids in digestion of fatty material. So after you have your gallbladder out, your diet may need to be adjusted, but otherwise a person can live without a gallbladder and an appendix. So still have my appendix, but I don't have my gallbladder anymore. You can get a CT of the abdomen. That's a painless, non-invasive X-ray procedure. It produces an image created by a computer representing a detailed cross-section of the tissue structure within the abdomen. This is called a virtual, like a, what's the word I'm looking for? I just went blank. Oh well. So this uses CT scanning or an MRI to obtain the interior view of the colon that is usually seen with an endoscope. So it's a virtual colonoscopy, right? So it's a little bit less invasive. So it's non-invasive. It's a painless procedure. It provides 2 to 3 dimensional images that can show polyps and other lesions as clearly as a direct visual colonoscopy. I still can't think of the word I was going to use. Oh, well. Okay, so endoscopic retrograde. This examines the size of and feeling of the pancreatic and biliary ducts through direct radiographic visualization with a fiber optic endoscope. And then we have an EGD, which is an esophagogastroduodenoscopy. Sure. So that's the process of a direct visualization of the esophagus, the stomach, and the duodenum using a lighted fiber optic endoscope, and it's also known as an upper endoscopy. That's a big word. And then we have this extracorporeal shockwave lithotripsy. So this is an alternative treatment for gallstones by using an ultrasound to align and computerize that lithotripter. And what it does is it helps to break up the stones so that you can pass them. So they'll pass kind of like I showed you in that common bile duct or that cystic bile duct. They'll pass a little bit easier, and then they can either be removed surgically, or you can pass them and then just pass them in your bowel movements. Then we have fluoroscopy. This is a radiographical technique used to examine the function of an organ or a body part using a fluoroscope. We have gastric analysis. This is the study of the stomach contents to determine the acid content and to detect the presence of blood, bacteria, bile, and abnormal cells. A gastric lavage. So this is an irrigation of the stomach with sterile water or saline. And then we have a herniorrhaphy, which is a surgical repair of a hernia by closing the defect using sutures, mesh, or wire. A liver biopsy. So this is when a piece of the liver tissue is obtained for examination by inserting a specially designed needle into the liver through the abdominal wall. So question, a colonoscopy evaluates the lower portion of the digestive tract with a scope, while a blank evaluates the upper portion. Remember that big long word? Good. So it's A. So the abbreviation is EGD. It stands for that big long word right there. The majority of the small intestine cannot be reached with either test, however. Hush, lady. Sorry, guys, my dog's crying. Okay, so a liver scan. This is a non-invasive scanning technique. It enables visualization of the shape, size, and consistency of the liver after an IV injection of a radioactive compound. And we have an MRI or a magnetic resonance imaging. This is a non-invasive scanning procedure that provides visualization of fluid, soft tissue, and bony structures without the use of radiation. We have a nasogastric intubation. So this is the placement of a tube through the nose into the stomach, and this is to help relieve any gastric distension by removing gastric secretions, gas, or food. Then we have a percutaneous transhepatic. Yeah, I'm not even going to try it. Okay, this is an examination of the bile duct structure using a needle to pass directly into the intrahepatic bile duct to inject a contrast medium. And then this is a 48-hour pH study. So this measures and monitors amounts of gastric acid let's see, reflux into the esophagus during specific period of time. The monitoring system determines how often stomach contents reflux, so come back up into the esophagus, how long acid stays in the esophagus, and how much reflux occurs at night. And it's used to determine the presence and severity of GERD. Okay. We have a serum bilirubin. This is the measurement of bilirubin level in serum. So the serum bilirubin levels are a result of the breakdown of red blood cells. And then we have the serum glutamic. Not even going to try it, guys. Sorry. This is an enzyme that has very high concentrations in the liver cells, and it's also known as an aspartate aminotransferase, or an AST. We have a small bowel follow through. So this is an oral administration of a barium sulfate. X-ray films are obtained at timed intervals to observe the progression of the barium through the small intestine. So basically how long it takes for something to get from one point to another. And then we have a stool analysis for occult blood. This is an analysis of a stool sample to determine the presence of blood not visible to the naked eye. We have a stool culture. So this is the placement of a stool specimen on one or more culture mediums, allowing for possible growth of colonies of microorganisms to identify a specific pathogen. And then we have stool guaiac, which is a test on a stool specimen using this guaiac as a reagent. It identifies the presence of blood in the stool. So I'll show you guys how to do that at one point. And then we have urinary bilirubin, which is the test for conjugated or direct bilirubin in a urine specimen. So true or false? An elevated serum bilirubin gives babies their yellowish appearance after birth, which is quite common. True or false? That is true. So usually a few sessions of phototherapy, so a special blue light will correct this. Sunlight is really good for this, and lots of fluid, so lots of eating time for itty bitty babies. And that's it. Okay, good job, guys. Any questions, write them down and we'll go over them in class. And we'll see you guys in lab.